We now come to the statement. I call the Secretary of State for Health. Secretary of State.
Thank you, Mr. Speaker. With permission, I would like to make a statement on Lord Darzi's investigation into the NHS. Unlike the last holders of this office, this government will be honest about the problems the NHS faces and serious about fixing them. That's why I asked Lord Darzi, an eminent cancer surgeon who served both Labour and Conservative-led governments with distinction, to conduct an independent investigation into the state of our National Health Service. I'm sure the whole House will want to join me in thanking him for producing this expert, comprehensive report, a copy of which I've placed in the library of both Houses. Mr. Speaker, I told Lord Darzi we wanted hard truths, warts and all. His findings are raw, honest and breathtaking. He says, and I quote, "Although I have worked in the NHS for more than 30 years, I have been shocked by what I have found." He has uncovered an enormous charge sheet, too long to list in this statement, so these are just a few. The NHS has not been able to meet its promises to treat patients on time for almost a decade. Patients have never been more dissatisfied with the service they receive. Waiting lists for mental health and community services have surged. 50 years of progress on cardiovascular disease is going into reverse. Cancer is more likely to be a death sentence for NHS patients than patients in other countries. And it's not just the sickness in the NHS that concerns Lord Darzi, but sickness in society. Children are sicker today than a decade ago, and adults are falling into ill health earlier in life. It's piling pressure onto our NHS and holding back our economy. Those are some of the symptoms. The report is equally damning on the causes. First, a decade of underinvestment, which left the NHS 15 years behind the private sector on technology, with fewer diagnostic scanners per patient than almost every comparable country, including Belgium, Italy and Greece. And mental health patients treated in Victorian buildings with cockroach and mice infestations, where 17 men are forced to share 2 showers in 2024.
Shocking.
Second, the disastrous 2012 top-down reorganisation overseen by Lord Lansley. Lord Darzi's assessment is damning, which I will now quote. "A calamity without international precedent. It took a scorched earth approach to health reform. By 2015, ministers were putting in place workarounds and sticking plasters to bypass the legislation. Rather than liberating the NHS as promised, it imprisoned more than 1 million NHS staff in a broken system for the best parts of a decade. The effects are still being felt to this day." Mr. Speaker, just imagine if all the time, effort and billions of pounds wasted on dissolving and reconstituting management structures had instead been invested in services for patients. Clearly, the NHS would not be in the mess it finds itself today. Third, coronavirus. Everyone can see the lasting damage caused by the pandemic. But until now, we didn't know that the pandemic hit the NHS harder than any other comparable healthcare system in the world. The NHS cancelled far more operations and routine care than anywhere else. As Lord Darzi writes, and I quote, "The pandemic's impact was magnified because the NHS had been seriously weakened in the decade preceding it." In other words, Mr. Speaker, it's not just that the Conservatives didn't fix the roof while the sun was shining, They doused the house in petrol, left the gas on, and COVID just lit the match. That's why waiting lists have ballooned to 7.6 million long today. Fourth, the failure to reform. I wouldn't complain about the diagnosis. I take responsibility if I was a party opposite. Fourth, and firmly at their door. So sit and listen. Since 2019, the previous government oversaw a 17% increase in the number of staff working in hospitals. Did it lead to better outcomes for patients? No. At great expense to the taxpayer, the NHS has instead seen a huge fall in productivity. We paid more but got less. A deplorable waste of resources when so many parts of our health and care services were crying out for investment. As Lord Darzi puts it, British Airways wouldn't hire more pilots without buying more planes. Doctors and nurses are wasting their time trying to find beds for their patients, dealing with outdated IT when they ought to be treating patients. Too many people end up in hospital because they can't get the help they need from a pharmacy, GP or social care. And the effective reforms of the last Labour government, which drove better performance and better care for patients, were mostly undone. That, Mr. Speaker, is why patients can't get a GP appointment, an operation, even an ambulance when they need one today. That's what they did to take the NHS from the shortest waiting times and highest patient satisfaction in history to the broken NHS we see today. Now, Mr. Speaker, Lord Darzi has given his diagnosis. It's over to us now to write the prescription. And we have three choices. The first is to continue the Conservatives' neglect and allow the NHS to collapse. That's the path they set the NHS on today. We could, as some of my critics on the left demand, pour ever-increasing amounts of money in without reform, wasting money that isn't there and that working people can't afford to pay. Wasteful and irresponsible. We will not take that path. This government is making a different choice. We choose recovery and reform, taking action today to deal with the immediate crisis by hiring 1,000 GPs the Conservatives had left without a job while patients are going without an appointment, and agreeing an offer to end the strikes that they allowed to cripple our health service. At the same time, we will introduce the fundamental reforms needed to secure the future of our NHS. Earlier today, my right honourable friend, the Prime Minister, confirmed that the government will publish a 10-year plan for change and modernisation on the foundation of Lord Darzi's report. Our plan that will deliver the three big shifts needed to make our NHS fit for the future. First, from analogue to digital, giving patients proper choice and control over their own healthcare. Finally realising the untapped potential of the NHS app. Fully digital patient records so your surgeon can see the notes your GP writes. And by marrying our country's leading scientific minds with the care of over 1.5 million NHS staff, we will put NHS patients at the front of the queue for cutting-edge medicines and treatments that we can only imagine today. Second, from hospital to community, turning our NHS into a neighbourhood health service as much as a national health service, so patients can get the tests and scans on their high streets, be cared for from the comfort of their own home, bringing back the family doctor, and building a national care service that can be there for us when we need it, able to meet the challenges of this century. Third, from sickness to prevention, taking the decisions they ducked to give our children a healthy, happy start to life. From stopping the targeting of junk food ads at children, banning energy drinks for under 16s, reforming the NHS to catch illness earlier, starting by offering health checks in workplaces and on smartphones, and delivering the tobacco and vapes bill that they failed to pass to tackle one of society's biggest killers. Mr. Speaker, Lord Darzi's diagnosis is that the NHS is in a critical condition. Unless we perform major surgery, the patient will die. But he also finds that its vital signs are strong, an extraordinary depth of clinical talent, a shared determination to improve care for patients, a public service free at the point of use, so that whenever we fall ill, we never have to worry about the bill. The NHS is broken, but it is not beaten. Every person I've met in the NHS during my first 2 months as Health and Social Care Secretary is up for the challenge. It will take time. But, Mr. Speaker, this party, the party that created the NHS, we've turned the NHS around before, and we will do it again. I commend this statement to the House.
Shadow Secretary of State Victoria Atkins.
Point of order.
Has the member been here? Points of order come at the end, and you can't intervene in the middle of this. Victoria Atkins.
Thank you, Mr. Speaker, and I thank the Secretary of State for advance notice of his statement. The NHS belongs to us all, and we all care about it. So let's stop the political posturing and talk constructively about its future. We all know that our healthcare system faces significant pressures, as do all health systems around the world. We are living longer and with multiple and complex conditions. We have wider societal pressures, such as the impact of social media on the development of some young minds, as well as the treatment benefits that cost pressures of miracle drugs developed by our world-class life sciences sector. And the shock of the pandemic has had catastrophic impacts on the NHS and its productivity. Now, I believe there is much to be proud of in the NHS. Its dedicated staff look after 1.6 million people a day, 25% more people than in 2010. It has more doctors, more nurses and more investment than at any point in its history. It is delivering tens of millions more outpatient appointments and diagnostic tests and procedures for patients than in 2010. And of course, we delivered the fastest rollout of vaccination for COVID in the world, freeing our society more quickly than other countries. And we have more healthcare in the community, with the opening of 160 community diagnostic centres, the largest central cash investment in MRI and CT scanning capacity in the history of the NHS, as well as 15 new surgical hubs and the launch of Pharmacy First, helping to free up to 10 million GP appointments with those living with more complex conditions. I would just say to the Secretary of State, I paid him the courtesy of listening to him in silence. I hope he would do the same to me. He was chuntering from a sedentary position. But we on this side...
Order. Can I just say, I want to hear the Honourable Lady. Your constituents also want what's being said. So please, let's give the same courtesies that I expected for the Secretary of State. Victoria Atkins.
Thank you, Mr. Speaker. Now, we on this side of the House have never pretended that everything was fixed. We haven't pretended that we have the monopoly on wisdom or that there are easy answers to the difficult challenges we face. For the NHS to thrive in its next 75 years, it needs to reform, modernise and improve productivity. This is why the Conservative government, working with NHS England, announced the NHS Productivity Plan at Spring Budget to transform how the NHS works through better IT systems for frontline staff, expansion of services on the NHS app, which is used by 3 out of 4 adults today in England, and the use of new technology, including voice-activated AI. Together, this would see productivity grow by 2% a year by the end of the decade and unlock £35 billion worth of savings. Yet it is not mentioned in the 163-page report. Why is such an important and forward-looking reform missing from this report? And can the Right Honourable Gentleman confirm that he is choosing to cancel it? A simple yes or no. New medicines and trials are an essential part of the productivity challenge. There is only one mention of NICE in the 163-page report. Again, does the government have a strategy for life sciences and the provision of rare medicines, including cancer and dementia drugs? And why have they paused the Childhood Cancer Task Force? This need for reform is also why we implemented the first ever long-term workforce plan with NHS in England to train even more doctors, nurses, midwives and other healthcare staff for the future. This plan was described by the NHS CEO, Amanda Pritchard, as, and I quote, one of the most seminal moments in our 75-year history. Yet it is not mentioned in today's report. Again, why is such an important and forward-looking reform missing from this report? Is the Right Honourable Gentleman going to cancel the new places and forms of training, including apprenticeships, that were to be provided through that plan? The need to modernise is why in 2019 we announced the largest programme of hospital building in modern history, 40 new hospitals across England by 2030. I'd be careful for some of these backbench MPs. Today, 7 new hospitals have opened. The Midland Metropolitan will open at the end of the year, and I imagine the Right Honourable Gentleman will enjoy going to its launch. And a further 18 are in construction, and we're not even halfway through the decade. But since January 2023, it has been Labour's plan to pause, review, delay, and presumably possibly cancel these new hospitals. They published their health mission then. It's on page 6 for those that haven't read it. In other words, this was always their plan to delay and possibly cancel new hospitals, and nothing to do with the Chancellor's questionable accounting since the general election. When this was pointed out in the general election campaign, Labour candidates ran around promising voters that their new local hospital or CDC was safe with them. In Torbay, Chelsea and Fulham, Basingstoke, Watford, Bracknell, Truro, Corby and Kettering, to name a few. Will the Right Honourable Gentleman confirm that Labour will delay these hospitals? And there is one... Forgive me.
It's difficult, but it's 5 minutes. It's now 6 minutes, 22 seconds. We're well over. Can we now conclude on that sentence? Thank you.
Very much. Thank you, Mr. Speaker. And there is one part of Great Britain where on almost every measure the NHS performs the worst. Labour-run Wales. The Right Honourable Gentleman has compared... I'm
sorry. I meant you conclude now, not to continue with the rest of the speech. Secretary of State. No.
Thank you, Mr. Speaker. The first word the Shadow Secretary of State for Health and Social Care should have said was sorry. She says she never pretended everything was fixed, and that's true, but it's about time that she admits that it was their party that broke the NHS in the first place. In fact, it's been a feature of debate in this House since the general election that the party opposite has taken absolutely no responsibility whatsoever for the mess they left our country in. A £22 billion black hole, a new hospitals programme she refers to, where the timetables were a work of fiction and where the money ran out in March. She knew that. She knew that when she went to the country to claim that the programme was fully funded. She talks about the decisions made by NICE, a new Labour reform and modernisation, thankfully one that did survive the last 14 years. And you know, Mr. Speaker, she's endorsed the Right Honourable Member for Newark in the Conservative Party's leadership election. I wonder what she makes of his admission that the Conservatives failed to make the tough reforms the NHS needed because they were afraid of what Labour might say. Is that not the most derisory excuse for 14 years of neglect? Mr. Speaker, my predecessor does not bear responsibility for everything in the Darzi report. This crisis was more than a decade in the making, but I wonder when she will show some humility on behalf of her party and apologise for the mess that her government made of our National Health Service. Otherwise, why should anyone trust what they have to say ever again? This government was given a mandate for change, and nowhere is that more needed than in our NHS. This report must mark the beginning of the long, hard work of change. It is the platform from which we will launch a decade of reform that will make sure the NHS can be there for us when we need it, for us, our children and our grandchildren. And, Mr. Speaker, in conclusion, it must draw a line in the sand so that we never go back to the pain, fear and misery the Conservative Party inflicted on millions of patients.
Can I just say to members, this will run for an hour, so please help each other. Right, let's try Clive Efford as a good example.
Thank you. Thank you, Mr. Speaker. I'll rise to the pressure. I welcome the Secretary of State's statement. And in 2008, the previous government commissioned a report from Sir Michael Marmot, the State of Society and Health, and he found that there was health inequality, particularly in deprived areas. 10 years on, he found, in his second report, he found that that had got even worse. Against the backdrop of a underfunded NHS, doesn't that just describe the scale of the urgency of the need to invest in those communities under this government, and what can he do to direct resources into those most deprived communities to turn around those health inequalities?
My honourable friend is absolutely right. Our country has stark health inequalities. It is not right that people who live in different parts of the country have such different chances of living well. A girl born in Blackpool can expect to live healthily until she is 54, whereas a girl born in Winchester can expect to live healthily until she is 66. Yeah. That's why, Mr. Speaker, with the mission-driven approach of the Prime Minister, we won't just get our NHS back on its feet and make sure it's fit for the future. We will reduce the cost and burden of demand on our National Health Service by attacking the social determinants of ill health.
Liberal Democrat spokesperson Daisy Cooper.
Thank you, Mr. Speaker. Much of the content of Lord Darzi's report has been known for some years, but nonetheless, today's report is a scathing summary of the complete devastation that the Conservatives have wrought on our health services and on the health of our communities. We Liberal Democrats have long argued that we need to shift healthcare from hospital to high streets and from treatment to prevention, because doing so improves health outcomes and it saves taxpayers money, so it's a win-win. But the report is long on diagnosis and short on prescription. So may I invite ministers on the bench to read our fully costed manifesto to fix public health and primary care by recruiting 8,000 GPs, ending dental deserts, giving a boost to public health grants by £1 billion, our 5-year plan to boost cancer survival rates and putting a mental health expert in every school. At the same time, Madam Deputy Speaker, steady on. Does the Secretary of State accept there is an elephant in the room, and that elephant is social care? Will he meet with me to discuss the Liberal Democrat plans for social care, starting with free personal care, a bold idea which will prevent many people from going into hospital in the first place, as well as enabling them to be discharged from hospital faster soon? Does the Secretary of State accept that it is a truth universally acknowledged that you cannot fix the NHS if you do not fix social care too? Yeah. And as for the dire state of our hospitals and primary care estate, well, Madam Deputy Speaker, like a wound, the Conservatives have left it to fester. Will he give the green light to hospitals which are ready to rebuild, such as mine in West Hertfordshire? And will ministers look to reform outdated Treasury rules that are preventing our ICBs and hospital trusts from spending and investing their funds in the GP practices and hospitals that we need? Madam Deputy Speaker, this government says that it wants growth. Well, health and wealth are two sides of the same coin, something the Conservatives did not understand. So if Labour wants economic growth, then fixing our health and social care must be their top priority, and it must be a priority without delay. Thank you.
Thank you, Madam Deputy Speaker, and how refreshing to have constructive opposition in the chamber. Let me say that, and it was clear throughout the election campaign, actually, that my party and the Liberal Democrats have much in common, both in terms of commitments we made, which were in some cases identical, and also the shared areas of emphasis, the link between health and wealth, the importance of prevention, and the importance of social care. And as the Prime Minister reiterated again this morning, we are absolutely determined both to address the short-term crisis and the long-term needs of the century in terms of our social care system, and wherever possible we want to work on a cross-party basis. So I'd be delighted to meet the Liberal Democrat spokesperson.
Dr. Peter Prinsley.
Hundreds of thousands of operations, including dozens of my own lists, were cancelled due to the strikes in the NHS over the last 3 years. Does the Secretary of State agree that the Conservatives' refusal to negotiate with the doctors contributed to the terrible state of the health service, and that ending the strikes is really the first step to fix the NHS?
I'm grateful for that intervention, Madam Deputy Speaker, and I can tell you, it really sticks in the craw to hear the carping and criticism from the party opposite and the obvious bitter resentment that we were able to do in 3 weeks what they failed to do in over a year, and all the while they complain about the cost of solving the strikes. They say nothing about the costs they ratched up, the direct financial costs of covering the strikes and the untold costs of misery to patients whose operations, procedures and appointments were cancelled. Even as the Shadow Secretary of State for Health and Social Care and her ministers hadn't even bothered to meet the junior doctors since March this year. They've got no grounds to complain.
Mims Davies.
Thank you, Madam Deputy Speaker, and I thank those that daily work in the NHS health services all across our country. Can the Secretary of State explain thoroughly why, if he is truly serious about assisting and supporting the whole of our NHS in England and all of our constituencies, as he says, warts and all, why health outcomes and experiences of families across Wales over the last 25 years do not merit this attention equally because it is Labour-run, perhaps?
Madam Deputy Speaker, I have never denied, nor has the Welsh Government, that right across the United Kingdom, our health and social care systems are in crisis, and waiting times and patient outcomes are not where they should be. The truth is that they will not wish to acknowledge, as even now, without a shred of humility or acceptance of the responsibility of their record in government, they cart from the sidelines. What they will not admit or accept is that different parts of the United Kingdom have different strengths and different weaknesses. And that is why I am proud that regardless of the fact that there is an SNP government in Scotland, or indeed a unique arrangement in Northern Ireland, as well as my friends in the Welsh Government, in the first weekend that I took office as the Secretary of State for Health and Social Care, I made it my business to phone my counterparts in Scotland, Wales and Northern Ireland and make it clear that whatever our parties and however hard we'll fight each other at the ballot box, we will always work constructively, because this government, rather than pointing fingers at other parts of the United Kingdom, as they did when they were in government, is determined, as the last Labour government did, to create a rising tide that lifts all ships. And I look forward to working with every devolved administration to improve health and care outcomes across the whole of our United Kingdom.
Stella Creasy.
Thank you, Madam Deputy Speaker. The Secretary of State is absolutely right that the future of our NHS does lie in reform and not waiting until people get sick before we intervene to keep them well. But we cannot do that without money either. He says we cannot waste money that isn't there, but we are wasting money that is there on the contracts that we have with the private sector. And he knows I feel strongly about this. There are millions of pounds being paid to private equity-backed funds to run sexual health centres in the NHS, eye care clinics. Billions of pounds is being lost to the legal loan sharks of our NHS, the PFI companies, where some trusts are spending more on PFI payments than drugs. Will he commit, as part of this process, to an urgent review of the way in which the NHS has worked with the private sector? Because reform must also include restructuring our debts.
I'm really grateful to my honourable friend for her question. I know she's done lots of work in this area, and I'd be delighted to meet her. And let me just give the party opposite a lesson in humility. Because however proud I am of the last Labour government, and I'm incredibly proud of what they did to our health estate in terms of the investment they brought in through a range of different types of private financing. I'm really proud of the impact that they had, and so I see the benefits for my own constituency. I have never shied away, at the same time as celebrating what we got right in government, of reflecting on what we didn't get right in government and genuinely learning lessons. That's what we did in opposition. It took us too long to get back here. We'll learn for that for the future. But it's really interesting listening to the party opposite in the last 9 weeks. They haven't learned anything, they haven't got the message, and they're not going to change.
Dr. Kieran Mullan.
Deputy Speaker. As Labour embarks on a reform programme, can I ask the Secretary of State whether he's read the Mid-Staffordshire Public Inquiry report that looked at shocking patient neglect the last time Labour were in charge? I think if he read it, it might temper some of the hubris I think he's showing in the Chamber today in the face of challenges that his colleagues in Wales have certainly not managed to overcome.
Destroy the system.
Madam Deputy Speaker, I would gently point the honourable gentleman to the bold claims that was made by the now Shadow Chancellor about patient safety, and then reflect on every subsequent patient safety scandal since. In fact, he might want to walk into a number of maternity services around the country and then ask himself, did they bother to learn lessons on patient safety?
Nick Smith.
Thank you, Madam Deputy Speaker. Pharmaceutical producers Orden Mackenzie and Activist UK charged excessive and unfair prices for hydrocortisone tablets. NHS spending on these products rocketed because producers gamed the system. Can I ask my right honourable friend how he will ensure that future procurement processes deter drug prices being rigged like this?
My honourable friend makes a great point, and he's given great service to this House's Public Accounts Committee in really drilling into the waste, the inefficiency and the exploitation of the public purse. I want to work with the great life sciences sector and pharmaceuticals industry that we have here in this country and also globally. But in the spirit of that partnership, it means a genuine partnership, a really good working relationship. It requires social responsibility, and it certainly involves not ripping off the taxpayer.
Andrew George.
Madam Deputy Speaker, I welcome this report, and of course the government has been left by the previous government of the NHS and care services in the worst crisis in their history. He leads by emphasising the decade of underinvestment. That needs to be coupled with very weak workforce planning. So when he meets with the Liberal Democrats, will he review our costed plan to raise the investment necessary in order to address the issues which he is highlighted in this report, and also to strengthen the workforce planning in order to be able to deliver these services?
I'm grateful for that question, Madam Deputy Speaker. Fiscal policy is, of course, a matter for the Chancellor, and I know where my bread's buttered, so I'm not going to write her budget or spending review now. Let me just reassure the honourable gentleman that notwithstanding the £22 billion black hole that the Conservatives left in the public finances this year, the weak foundations of our economy that we have inherited, the Chancellor knows as well as I do that it's investment and reform that will deliver the results. It is going to take time. We're not going to be able to reverse more than a decade of underinvestment in a single budget or even a single spending review. But at least we've got a government that is able to face up to the hard choices and is capable of making them.
Joe White.
Thank you, Madam Deputy Speaker. I very much welcome Lord Darzi's report, which exposes how our country has been let down by the previous government. In my Bassetlaw constituency, I will be asked, when will they get the GP appointment when they need one? And when will the 2,000-person dental waiting list come to an end? I'm also listening to my GPs and my dentists so that I can work with them to tackle this crisis, and I'll be meeting with them shortly. Can I ask the Minister what's his message to them all?
Madam Deputy Speaker, my honourable friend, who I'm delighted to see in her place representing Bassetlaw and who is already showing herself to be an outstanding champion for her community, she raises a really good challenge that all of us will be facing as constituency MPs, which is a recognition by the public on one hand that change takes time, and we're not going to be able to fix more than a decade of problems in the immediate future, but they want to know that at least we're hitting the ground running and getting the job done. So the reassurance I can give her constituents in Bassetlaw is that firstly, within the first couple of months of this government, we have employed 1,000 more GPs to the front line who had been left unemployed by the previous Conservative government. We did that pretty much immediately. We've settled, I hope, we'll wait to see the outcome of the ballot, the junior doctors dispute, so we can remove the cost of and disruption of industrial action so we can start work on getting the waiting list down. We'll be working at pace to deliver the 40,000 more appointments every week to cut waiting lists, the 700,000 urgent emergency dentistry appointments so that we can make sure that people get the care they need. Every single promise in our manifesto, Madam Deputy Speaker, notwithstanding the challenges in the public finances, was a promise we made that was fully costed, fully funded, promises we will keep and the country can afford.
Bernard Jenkins.
Thank you, Madam Deputy Speaker. Can I urge the Secretary of State to learn from what is working well within the NHS as well as what has gone wrong? Can I refer him to page 121 of the paper, paragraph 14, which refers to the Health and Care Act 2022, and I quote, "The result is that the basic structure of a headquarters, regions, integrated care boards, ICBs that is fit for purpose." And in particular, can I draw his attention to the Suffolk and North East Essex ICB, which is one of the most successful in the country? Can we learn from that success and build that success into other areas?
Thank you, Madam Deputy Speaker. Can I just say, firstly, thank you to the honourable member for the constructive way in which he's approached these proceedings. And the tragedy is, with the Health and Care Act of 2022, that a large part of its focus was trying to correct the enormous damage done by Lord Lansley and that top-down reorganisation that nobody wanted and the country couldn't afford. It's why I've said very clearly we're not going to repeat the mistakes of top-down reorganisation. We're going to take the approach in terms of the architecture of the system of evolution rather than counter-evolution. And actually, to his point about learning from what's working well in the NHS, it is the thing that gives me great hope about the future of our National Health Service. Every day there are amazing people providing great quality care who are reforming, innovating and showing us what the future looks like. It is the responsibility of this government to take the best of the NHS to the rest of the NHS, and that is exactly what we will do.
Olivia Blake.
Lord Darzi's report is grim reading and it lays bare the failure of the last government. NHS staff up and down the country will recognise everything in this report. Does the Secretary of State agree with me that much more is needed to retain, recruit and compensate NHS workforce to make sure that we have a workforce fit for the future?
I'm grateful to my honourable friend because for all of the innovation that modern technology will bring, from the revolution in big data, AI, machine learning, medical advances that we will see very soon that we can scarcely imagine today, health and social care will always be fundamentally a people-based service. And if you don't value your people, you lose them. And we end up in the appalling situation we're in today, where we spend so much money investing and time investing in the training of people who imagine for themselves a long future in the NHS, but because of the reality they have been subjected to by the previous government, are packing up and moving to different careers altogether or moving to other continents altogether. We are determined not just to recruit the great staff we need, but to value and retain the brilliant staff we already have.
Dame Caroline Diney.
Thank you very much, Madam Deputy Speaker. The Secretary of State will know that cancer is the biggest cause of death by illness of children under the age of 14 in the UK, and this is Children's Cancer Awareness Month. He won't know that it's also the 3rd anniversary of the death of my constituent Sophie Farrell. She was 10 years old, and it's with Sophie's mum Charlotte that I've been campaigning for the last 3 years for the Children and Young People's Cancer Task Force to be set up. Now, that task force was set up at the beginning of this year with a stated aim of meaningfully changing the way that we detect, the way that we treat and the way that we care for children with cancer. Now, I've listened to him very carefully and I've heard him very passionately set out how he is wanting to focus on prevention and early intervention, and yet this month, Children's Cancer Awareness Month, we've also learned that he's pausing the Children and Young People's Cancer Task Force. Parents of children with cancer and myself are deeply disturbed by this announcement. I wondered if he could set out why.
Absolutely, and firstly, can I first thank the honourable member for the intervention, the way she's put it, and send my deepest condolences to Sophie's family on what will inevitably be a difficult day, and I suspect just the latest of what will continue to be many difficult days in the unimaginable pain and grief and loss that they have suffered. Just to reassure her, firstly to thank her for the work she's done over many years championing children's cancer in this House on behalf of her constituents and so many other families affected by young cancer. The pause is because we want to make sure that as we look at the breadth of the work of the department, that we've got the right vehicles to deliver the outcomes that we want to see. That's why we've paused rather than cancelled or slammed or criticised the work that she was already doing. And I'd be delighted to meet with her to talk about the genesis of the task force and how we can take forward the outcomes that she wants to see. What we're trying to avoid is a plethora of task force and the risk that we've sometimes seen, and this is not a party political point because this spans successive governments, of task forces being an alternative for action. And I know that she wants to see action, so let's meet and see what we could do together.
Jacob Collier.
Thank you, Madam Deputy Speaker. When I grew up in Stretton under the last Labour government, I could see my family doctor and get an appointment the next day. After 14 years of the Conservatives, Stretton residents now often must travel over 6 miles to another GP surgery in another village just to get an appointment that they've already waited weeks for. Does the Secretary of State share my view that this is unacceptable, that it now falls to this government to fix their mess?
My honourable friend's absolutely right. It's about making sure we've got the right staff in the right place and an equitable distribution of access to NHS services right across the country. And it is also about shifting from a hospital-centred NHS we see today to the neighbourhood-centred service we want to see. That's why we've acted immediately to put 1,000 more GPs onto the front line before the end of this year, and why I'm looking forward to working with GPs to expand access to primary care right across the country, especially in communities which are particularly underserved.
James Wilde.
Thank you very much, Madam Deputy Speaker. This review highlights the need for capital investment in the NHS, and the question NHS staff and patients in North West Norfolk have is urgent. Is this government committed to replacing the current rack-propped hospital with a new Queen Elizabeth Hospital in Kings Lynn by 2030, yes or no?
I can absolutely reassure the honourable member that rack-based hospitals are a priority. We're putting safety first, and it's just a shame that when they had a Prime Minister in their backyard, they didn't fix it then.
Debbie Abrahams.
Thank you, Madam Deputy Speaker. And I just, the openness and transparency, just to mention that I am a former chair of an NHS trust and a public health academic. I recognise the real issues that are raised within the findings of the Darzi rapid review. I'm also grateful that he referred particularly around the inequalities that we experience and how these inequalities laid bare and were exposed during COVID. Could the Health Secretary expand on the cross-departmental work that he's doing? Because following on from the comments from my honourable friends from Walthamstow and Eltham, it is the socio-economic circumstances that people find themselves in which will drive their health status. And we don't want to see the position where for every 1% increase in child poverty, 6 additional babies per 100,000 live births will not reach their first birthday.
Can I thank my honourable friend for her question, congratulate her warmly on her election as the chair of the Work and Pension Select Committee. I'm looking forward to sharing through the Secretary of State the work that our departments are doing together, particularly on the link between mental health and unemployment and integrating pathways. She's absolutely right about the social determinants of ill health, and that is why I'm genuinely excited that with the mission-driven approach the Prime Minister set out, we are already bringing together Whitehall departments, traditionally siloed, to work together on attacking those social determinants. And the real potential and the real game changer is taking genuine cross-departmental working with also working alongside business, civil society and all of us as active citizens to mobilise the whole country in pursuit of that national mission. Tough on ill health, tough on the causes of ill health, as someone might have said.
Father of the House, Sir Edward Lee.
I greatly respect the Secretary of State, and as an older person who relies on the NHS, I support his radical zeal. But may I quote what he said in his statement? Cancer is more likely to be a death sentence for NHS patients than patients in other countries. Now, we've had this conversation before, but can he at least look at other countries and their health systems, particularly the Netherlands and Australia, France and Germany, which, whilst protecting the vulnerable and having wonderful health systems, have a mixture of social insurance, public and private, to maximise inputs into the health service? Will it at least look at these models?
Madam Deputy Speaker, every time the right honourable gentleman praises my zeal for NHS reform, people on my side get very nervous. And let me reassure him, though. Look, I have looked at other countries, and I'll definitely continue to do that, and that's the reassurance I give him. I genuinely don't think it's the model of funding that's the issue, the publicly funded public service element. I really don't, and I hope he knows me well enough that if I did think that was the case, I'd be more than happy and would quite enjoy taking on the argument. But I think the equitable principle that underpins our NHS is one that we should cherish and protect, and the single-payer model has enormous potential for the century of big data, AI, machine learning. There's huge unlocked potential there that we must unlock, but that doesn't mean we can't learn from the way in which other countries organise models of care, particularly in the community, particularly in social care. I met this week virtually with my friend, the Health Minister for Singapore. I'll continue to work with my international counterparts to learn from other countries whose health outcomes are far better than our own.
Rachel Taylor.
Thank you, Madam Deputy Speaker. In my constituency of North Warwickshire and Bedworth, patients wait far too long for GP appointments, while the party opposite have presided over sticking plaster solutions, papering over the cracks in our health service rather than making it fit for the future. Does the Secretary of State agree with me that today's report is a chance to get the right diagnosis of the problems so that this new Labour government can come up with the right prescription and my constituents can once again get the treatment that they so desperately need?
I'm delighted to see my honourable friend in her place. She's absolutely right. And we will take Lord Darzi's diagnosis to now write the prescription and ensure that our reform agenda benefits every part of the country, not just big cities, not just the wealthiest communities, but every part of the country, to make sure that whoever you are, wherever you're from, and wherever you live and have grown up, that you have access to the very best health and care services.
Ayub Khan.
Thank you, Madam Deputy Speaker. One important and key finding in the Darzi report is that staff morale, the NHS staff morale, is low. In fact, the Medical Defence Union of Medical Practitioners states recently that more than 44% of the NHS staff will reduce the number of hours they will work because of the low morale. Will the Secretary of State seek to meet up with Medical Defence Union to explore some of these issues and work out ways in improving staff morale?
Madam Deputy Speaker, of course we seek to work constructively with all trade unions representing staff across our health and care services, and also the Royal Colleges. We want to work in a spirit of partnership, and of course we are only able to do that because people sent Labour MPs to Parliament to replace the Conservatives.
Rachel Maskell.
Madam Deputy Speaker, I agree with my right honourable friend. This is the most devastating analysis I've read of the NHS in over 30 years, and it just shows what challenge lies before him. And talking of challenges, will he challenge the ICBs to focus on moving those resources into primary care, and particularly look at what's happened in York, where Nimbus Care have been able to pull out those services from the acute service and be able to deliver work in the community?
I'm really grateful to my honourable friend for her intervention. She has a huge amount of expertise in health and care, and she's absolutely right about the need for that shift. And I've made it very clear to ICB leaders and to trusts across the country that I want to see a bigger focus on secondary prevention. And that means much more activity in the neighbourhood. I know she'll keep on challenging these causes. She's a good critical friend, and I know she'll hold my feet to the fire to deliver.
David Simmons.
Thank you, Madam Deputy Speaker. And I declare my interest as the husband of an NHS doctor. Madam Deputy Speaker, I served as a non-executive director of my local NHS trust the last time that Lord Darzi was brought into service by a Labour government, shortly before they appointed him to the House of Lords. And I'd like to ask the Secretary of State, will he take steps to ensure the widest possible level of input from senior clinicians? Because it's clear that those like Professor Sir John Bell do not share Lord Darzi's prescription for the improvement of the NHS. And I'd also like to ask the Secretary of State, will he apologise to my constituents for the doubt that he's cast over the future of the new Hillingdon Hospital, where work had already started under the previous government?
Madam Deputy Speaker, I'd say two things. Firstly, I'm not sure that's a fair characterisation of Sir John Bell's position. I have a huge amount of respect for him, and indeed grateful to Lord Darzi for writing the diagnosis. Can I just say, for a party that was in government for 14 years, that repeatedly promised the rebuild of Hillingdon Hospital, and left my department in a position where the money for the new hospitals programme ran out in March, he's got some brass neck to sit on that side and point fingers over here.
Sean Woodcock.
Deputy Speaker, in 2016, the Horton Hospital in my constituency lost its consultant-led maternity unit, a temporary downgrade that ended up being made permanent 3 years later. Isn't it about time that someone from the party opposite apologised for the damage done to Banbury's Hospital, as well as to the NHS as a whole?
I'm really delighted to see my honourable friend here. His constituents can already see he's not backwards in coming forwards. He will stand up and champion their interests in this House as a great constituency MP. When it comes to the party opposite, Madam Deputy Speaker, sorry seems to be the hardest word.
Alison Bennett.
Thank you, Madam Deputy Speaker. I welcome the Secretary of State's announcement about the shift from hospital to community care. And of course, as I and my fellow Liberal Democrats fully believe, fixing social care is part of the solution for getting the NHS back on its feet. So I will also welcome the announcement of a National Care Service being brought forward. Part of care in the community is, of course, the hospice sector. And recently I met the Chief Executive of St Catherine's Hospice, which is in the Honourable Member for East Grinstead and Uckfield's constituency. And he highlighted to me that although that hospice has 24 beds, they are only currently using 12 of them. What assurance can the Secretary of State give me and people right across the country that fixing the hospice sector is going to be part of the solution as we take the NHS forward?
Madam Deputy Speaker, I'm so grateful to that question, not least because it gives me the chance as a constituency MP to say a huge thank you to St Francis Hospice, to Haven House Children's Hospice for the care they provide to my constituents, just like so many other hospices around the country. But I know the sector is under real pressure, and we will look forward to working with the sector throughout the spending review period and over the course of the 10-year plan period to not only support our hospices, but also to improve end-of-life care, which is particularly pertinent in light of the debates I know will be coming before this House and the other place in terms of how we ensure a good death for everyone in every part of the country.
Tahir Ali.
Thank you, Madam Deputy Speaker. On Tuesday, I was at the Birmingham Children's Hospital. Would the Secretary of State join me in congratulating the excellent staff and the work they're doing and the commitment they're giving to each and individual patient that goes through that door? On that evening, I was also with a local GP at Sparkbrook Health Centre, and his frustration was the outdated computer system. Dr. Abad Bhatti said if you can get one message across to the Secretary of State is he has to reboot that computer numerous times in the day, and will you be able to put resources in to make sure that the IT is up to date?
Yeah. So grateful to my honourable friend for his question. Firstly, he's right that we should celebrate and thank staff who are doing an outstanding job against a very difficult set of circumstances. And on the second point he raises, absolutely, we've got to make sure that on the tech side, we unlock productivity in the system, having literally sat looking over the shoulder of GPs at their IT systems. I well understand those frustrations. And just for the benefit of all observers today, there's sometimes a perception that I'm up against NHS staff when it comes to reform. Actually, it's staff who are crying out for change.
Bob Blackman.
Thank you, Madam Deputy Speaker. One of the aims of the Lansley reforms was to transfer from ministers to clinicians decisions on the day-to-day running of the health service. It's not clear from his statement whether he intends to change that process or not, but can I give him some constructive proposals that he might take on board? And that is to streamline the business planning side of the NHS. They have to go through multiple series of bids, preparations of business plans before decisions are made. That costs more money on employing business consultants than consultants in hospitals. I've campaigned for this for many years. Will he take this on board now?
The Minister of State for Health was whispering in my ear that it was her frustration with exactly the sort of bureaucratic processes he describes that led her to seek elections as a Member of Parliament to sort it out. And so I can absolutely now defer this one to her. But on a serious note, he's right. We've got to, wherever we find waste and inefficiency designed in, we've got to deal with that. I want to see an NHS that is more clinically led, free from political interference. But we've also got to be honest about the fact that it is such an enormous part of the public sector, and the public pays such an enormous price for it and value it so much. There will always need to be an accountability relationship. But what I've tried to build with NHS England in the last couple of months, and with real joy in the process, is building a real team between the Department of Health and Social Care and NHS England, as well as the team across the country. And I look forward to continuing to galvanise that team as we embark on the 10-year plan process.
Dr Marie Tidball.
In my constituency, a staggering 28% of patients said that it was not easy at all to get through to someone at their GP practice. And worse, the figure for patients who said doing this was generally easy was far below the national average. Does the Minister agree with me that the Conservatives have pushed the NHS to breaking point and only this government can get the NHS fit for the future?
I'm very delighted to see my honourable friend in her place standing up for her communities in Penistone and Stocksbridge, and I can absolutely tell her that it was very frustrating for me in opposition watching successive ministers promise better hold music for people trying to get through to the GP rather than actually solving the problems of access, fixing general practice and building general practice so it can meet the needs of this century will be a vital part of our 10-year plan process.
Mark Francois.
Thank you, Deputy Speaker. Can I make the Secretary of State a little more nervous? Darzi makes 7 high-level recommendations, the 4th of which is to drive productivity in hospitals. From 2017 in South Essex, we saw a merger of Basildon, Chelmsford and Southend hospitals to create the Mid and South Essex Hospital Trust. It's not been an unmitigated success. As local MPs, we were promised significant back-office savings that could be channelled into patient care. In fact, the reverse has been true. And there's been such a turnover of senior managers in that trust in recent years. It's been like a game of musical chairs. The trust are now trying to appoint 3 permanent managing directors for each hospital to provide stability, which makes sense. But they're offering a salary of £200,000 for each post, which is more than the Prime Minister earns to run the country. So now that it's on his watch, would the Secretary of State take a personal interest in this? We should pay a good rate for that job, but £200,000 sends all the wrong signals to all the other very hard-working people in the Trust.
Thank the right honourable for that intervention. He's not too far away from me geographically, but he's miles away from me politically, and I always get nervous when he stands up to praise me. Look, I think we do have to keep a sharp eye on value for money. I think Darzi presents some, if I can put it this way, politically challenging messages around NHS management, because I could be wildly popular with the country if I stood up and said I'm going to take the axe to management across the country and sack loads of managers. What we need is better management and a sharp eye on value for money. The NHS would not work without good leadership. We've got to make sure we've got the right people in the right place and delivering against the public's expectations. So it's a more nuanced position, but I'm sure what he's heard will have been heard by his local trusts, and I'm certainly going to be keeping an eye on value for money right across the country.
Rachel Hopkins.
Thank you, Madam Deputy Speaker. The Darzi report rightly says that prevention is better than cure, and that public health interventions that protect health are far less costly than tackling the consequences of illness and ill health. So does my right honourable friend agree with me that the recklessness and incompetence of the 14 years of Conservative government stripping millions from local authorities who deliver the public health work has contributed to children being sicker than they were 10 years ago and adults getting iller sooner?
My honourable friend is absolutely right, and at some point they're going to have to take responsibility for it. They're going to have to take responsibility, because we learned through bitter experience, if you don't change as a party, the country won't choose to change the government. So long may they continue with their heads in the sand, and long may we continue to get on with the job of clearing up their mess and building an NHS fit for the future. But can I also say, particularly as the Secretary of State for Social Care, that the relationship between the NHS and local government, and my department and local government, is of particular importance, which is why I was especially delighted this week, Madam Deputy Speaker, the Prime Minister chose to appoint Tom Reardon, the Chief Executive of Leeds City Council, as Second Permanent Secretary, an outstanding public service servant with a demonstrable record of health and care integration, public health and prevention, and I'm looking forward to having that local government perspective and local community delivery perspective at the heart of our department.
Richard Tice.
Thank you, Madam Deputy Speaker. Well, I think the Secretary of State, in his statement today, and the whole House agrees, the NHS needs reform. The reality is, when you speak to people in the NHS, almost all say to me, it's not a shortage of money, Secretary of State. The levels of waste, bureaucracy and mismanagement are legendary. Indeed, this report specifically refers to the huge quantities of regulators, accountants, bureaucrats, top down. And so I would ask the Secretary of State, is there a recognition within the NHS senior leadership that actually reform to the management is a critical part of improving healthcare in the United Kingdom?
I welcome the honourable member to his place and thank him for that question. When you've got a huge volume of regulation, I'm always cynical, because you reassure yourselves as legislators and regulators that because you've put a regulation in place, you've dealt with the problem. And the problem is, you then put another regulation in place because you failed to deliver, and so then you put another regulation in place and more regulation in place, and before you know it, you've drowned the people responsible for delivery in so much regulation that they can't sort the wheat from the chaff, see the wood for the trees, and then you compromise standards and you compromise patient safety. And that's why I really welcome the work that Penny Dash has already done in relation to the CQC, and the work we will continue to do with her to reduce the burden of regulation, to focus on the things that really matter, to free NHS staff from red tape. I hope the honourable gentleman finds that reassuring. Can I just make a plea that he doesn't send his party leader to agree with me as well? I really am in trouble.
Julie Mims.
Mr. Speaker, I should declare an interest. I am the mother of an NHS nurse. I think it's really important that we remember what is at the centre of this issue, and that is people. And what that looked like in my Carlisle surgery last week were 3 individuals who came to me at the end of their tether because of the care their loved ones had received or not received at our local hospital. One was the husband of a woman who has profound physical disabilities. She cannot leave the house unaccompanied, but she now has no trust in her local hospital because, amongst other things, her recent care involved her being fed food she was known to be allergic to. The second are the parents of a young woman who has epilepsy, a physical disability, profound anxiety, but the failure for there to be a care plan in place that takes account of all that now means she's self-harming. And the other one was an elderly woman whose husband was discharged from the hospital without her consent and is now in a care home 20 miles away, and she can't visit them. Can the Secretary of State please give an assurance to those 3 individuals that this government will not only fix our NHS, but will restore their broken trust in it?
I'm so grateful to my honourable friend. I enjoyed visiting her Carlisle constituency ahead of the general election campaign. I look forward to working with her to improve health services in Carlisle and actually right across the North West, especially in some of the rural and coastal communities who rely on Carlisle Hospital as well as more local neighbourhood services. I've got to warn new members of the House. One of the most depressing things about the last 9 years as a Member of Parliament has been constituency advice surgeries, when people come to see you with the consequences of the failure of government and the failure of this place. we owe it to them to do better integration of health and care services, better access and better outcomes, and better joined-up care, because as my honourable friend has painfully described, if you do not tackle the problems early on, they become multiple problems, higher costs and personal tragedies, and we have seen enough of that.
Dame Harriet Baldwin.
Thank you very much, Madam Deputy Speaker. This House famously has not seen the impact assessment of taking away the winter fuel allowance from frail 85-year-olds and 90-year-olds on low incomes. Did Lord Darzi or the Secretary of State see the impact assessment in terms of bed capacity over the winter to come in our NHS as a result of this decision?
The Right Honourable Member, Madam Deputy Speaker, is an experienced member of this House, both as a former chair of the Treasury Committee and as a former Treasury Minister. She knows how impact assessments are done in the Treasury. She knows that impact assessments on all of the Chancellor's fiscal decisions at the budget and the spending review will be published at that time. And she also knows, I suspect, that when you look at the impact of the withdrawal of winter fuel allowance from some pensioners as it's targeted at those most in need, nonetheless still leaves those pensioners better off because of this government's commitment to maintain the triple lock, to extend the warm homes discount and the hardship support available so that pensioners are not left behind as we clean up the £22 billion mess that they left behind.
Uma Kumaran.
Madam Deputy Speaker, and thank the Secretary of State for his statement today. Lord Darzi's report lays bare the scale of the challenges our NHS faces. Does the Secretary of State share my deep concern that thanks to the dismal record of the party opposite, progress made by the last Labour government on heart disease and stroke, something that I've had recent personal experience of, is now in reverse, and that the number of people dying before the age of 75 in England from cardiovascular disease has risen to the highest level in 14 years?
I'm delighted to see my honourable friend in the House representing my old East End stomping ground, and I wish her and her husband well in his recovery and their recovery as a family from his experience. Let me also just reassure her that when it comes to the future of health and social care, that we will clean up the mess that they have made. It will take time, and when you look at the reverse in the progress made on cardiovascular disease and some of the early warning signs of an uptick in smoking, it is why we've got to put public health and prevention at the forefront. And that's not just about what's good for the individual and good for their health and good for their chances. Look at what the OBR's saying today. Look at the cost to the Exchequer now and in the longer term. We have no choice but to act.
Nigel Huddleston.
Thank you. A key conclusion of this report is the absolute necessity to focus on productivity and not just throw money at the NHS. I think we all agree that. And government ministers are constantly telling us, things we already knew, that government is about making difficult decisions. Can I ask the Secretary of State, therefore, in one of his first opportunities why he did the absolute opposite of that? In solving the doctors' dispute, he took the easy option, he threw money at it and did not require productivity enhancements and changes. I hope in the future, can you give me the reassurance that he will practice what he preaches?
Madam Deputy Speaker, I like the honourable gentleman very much. But the audacity of criticising this government for cleaning up their mess and failing to acknowledge the cost, both the cost to the Exchequer and the cost to patients in delayed, cancelled operations, appointments and procedures, more than £1 billion lost in money, more than 1 million appointments cancelled because of their gross incompetence and failure to understand the difference between they're penny wise and pound foolish. That's why the Conservatives have been sent to opposition, and that's why Labour's been trusted to clean up their mess.
Natasha Irons.
Madam Deputy Speaker. Madam Deputy Speaker, there can be no greater example of the previous government's failure than the shocking outcomes for our children and young people that Lord Darzi's report highlights. Our children now have some of the worst health outcomes in Europe. Higher rates of obesity, diabetes and asthma, poor oral health and mental health. From head to toe, they have been failed. Will the Secretary of State ensure that this government's long-term plan for our NHS will give the health of our young people the priority that it deserves?
I'm delighted to see my honourable friend in her place. She might be from the wrong side of the river, but she's absolutely right about the importance of prioritising children's health. And as the Prime Minister said this morning, it is shocking that the #1 cause of hospital admission is tooth decay amongst children aged between 6 and 10. I was criticised by the Shadow Secretary of State because she said I called our children short and fat. She's more outrageous by me calling out the scourge of childhood obesity that her government fuelled than the actual scourge of childhood obesity, and that is why we will act and why they failed.
Richard Ford.
Speaker, I welcome that the Health Secretary talks about a shift from hospital to community care. This builds on the findings of Lord Darzi that 13% of beds are occupied by people who are waiting for care in more appropriate settings. Caring for patients in community hospitals is much more cost-effective than caring for patients in big acute hospitals like the Royal Devon and Exeter, where I live. What thought has the Secretary of State given to the use of community hospitals that lost beds in the last decade, such as Seaton, Axminster, Honiton and Ottery St Mary?
I'm really grateful to the honourable gentleman for his intervention. He's absolutely right about the value of community hospitals, of step-down accommodation and care close to people's homes, or better still, wherever possible, in their homes, so long as it's clinically safe and the right support and care is available. That will be at the heart of our 10-year plan for reform and modernisation, that shift from hospital to community. And in common with lots of his colleagues on those benches and lots of the colleagues behind me, he's already done a very good job putting his local lobbying of ministers on the record in the House already.
I will be aiming to end this statement at 1, and can I remind members that any member who wasn't in for the start of the statement won't be called. Polly Billington.
Thank you very much, Madam Deputy Speaker. A recent survey of staff in East Kent Hospital University Foundation Trust showed that less than half of employees will be happy for their loved ones to be treated at an East Kent hospital. That is a devastating verdict from staff, showing the impact on their morale and on confidence in the community for the care that they need. Does the Secretary of State agree with me, however, that a broken NHS is not the fault of staff like them, but down to the previous government's decade of austerity and top-down reorganisation of the NHS?
I'm absolutely delighted to see my honourable friend in her place. She's absolutely right. I feel really sorry for NHS staff for what they've been put through over more than a decade of mismanagement and political incompetence. We will work with them to clean up their mess, and she establishes exactly the right test, which is, would we, would we, for our loved ones, want them to be treated in our local health and care services? Would we have the confidence that in every case, on every occasion, and in every interaction receive access to the best high-quality care? The truth is, we don't have that certainty, and too often it feels like chance. That is why we will always put the patient voice, the patient interest and the patient experience at the heart of our reform and modernisation programme.
Jim Shannon.
Thank you, Madam Deputy Speaker. Can I thank the Secretary of State very much for his honesty in his statement today, and also put on record my thanks to the Secretary of State for his contact with the regional minister responsible at the Northern Ireland Assembly. The first actions of a Secretary of State who I would suggest, Madam Deputy Speaker, doesn't run away from the issues, indeed takes them on head on, and congratulate him on that. I appreciated the terminology used in the reports that outlines the seriousness of the NHS conditions, but also highlights that vital signs are still strong. Will the Secretary of State outline how he intends to address the fact that the NHS in devolved regions is in arguably worse condition? And will the Secretary of State further confirm that this review will incorporate Northern Ireland and ensure that findings, new practices and standards will be in place for Northern Ireland, along with increased funding in a new funding formula? Madam Deputy Speaker, thank you.
Can I firstly thank the honourable gentleman for what he said? Coming from him, that means a great deal to me. And secondly, reassure him that I'm really committed to working with ministers in all devolved administrations to work together to improve health outcomes for everyone in every part of our United Kingdom. I know that the system is particularly pressed in Northern Ireland, and I'll do whatever I can working with ministers in Northern Ireland to help with that situation and create the rising tide that lifts all ships right across the UK.
Josh Fenton Glynn.
Mr. Speaker, I think I truly learned to appreciate the NHS when I became a parent and saw the care given to my family and children. It therefore horrified me, having also sat in A&E with an ill child, to see that in Lord Darzi's report 100,000 infants waited over 6 hours in A&E last year. Does my right honourable friend agree with me that this is a shocking state to leave the NHS in, and will my honourable friend commit to bringing those numbers down and making sure that parents don't have to endure that terrible wait?
See my honourable friend representing Calder Valley, and he's, I think, just captured the fear and anxiety experienced by far too many parents when accessing A&E departments about the length of the wait. It is a terrifying experience, particularly for parents with small children, to be in that situation. And frankly, the lack of focus on paediatric waiting lists and waiting times, whether in A&E or for electives, is really shameful. We've got to put children first, and that is exactly what this government will do.
Jessica Tarl.
Thank you, Madam Deputy Speaker. Constituents in my Bournemouth West constituency have faced rising NHS waiting times. We have GP surgeries closing despite rising populations and health burdens. There are no dentists accepting any NHS adult patients, and residents are being told to go to Southampton. And the junior doctors and nurses I meet are devastated that they can't deliver the quality of service that they want to. Does the Secretary of State agree with me that while the road ahead is long, Lord Darzi's frank and really raw assessment is the first step to really the road to recovery under a Labour government?
Delighted to see my honourable friend in her place, representing the people of Bournemouth, and I'd say to her the great thing about where we are at this moment is that for the first time in a long time there is a feeling of hope and optimism about what the future could be, and we are determined to build on that and give the staff and the patients the confidence of knowing that the best days for the NHS lie ahead.
Calvin Bailey.
Madam Deputy Speaker, Lord Darzi's report highlights the use of capital expenditure to cover in-year spending by successive Tory governments. Money intended for long-term investment has been redirected over and over and has exacerbated the extremely serious and urgent problems that the Secretary of State so rightly is raising today. Would the Secretary of State agree this has stopped us from making progress on capital projects that would enable big productivity improvements and improve access to care for all of those, particularly in my constituency of Leighton and Wanstead?
I'm delighted to see my parliamentary neighbour in his place. He's got big shoes to fill, and he will certainly do that. I would say to him that this is the vicious cycle that the Chancellor and I are determined to break, where ballooning costs and overspends in day-to-day spending sees raids on capital and tech budgets to fund the shortfall. The £22 billion black hole that we have inherited is a direct example of exactly where Conservative short-termism leads, and that's why in the spending review I can absolutely give my honourable friend the assurance that productivity, tech and capital are my focus in my representations to the Chancellor, and the work we will do together to fix the mess that they left behind.
And can I ask members to please help each other by 1 or 2 sentence questions? Emily Darlington.
Thank you, Madam Deputy Speaker. Just want to turn again to a subject I know is close to the Secretary of State's heart, and to say that do you agree with me that the actual experience of people is how we will measure whether or not the NHS has been improved? My children's grandparents, for one diagnosed under a Labour government, 12 great years of having cutting-edge treatments, and that 12 years with their grandchildren, and their grandfather diagnosed under a Conservative government. 12 weeks was the experience that we had.
I'm grateful to my honourable friend and the work she does championing Milton Keynes, and therein lies the challenge. It cannot be right that delays in diagnosis lead to the difference between life and death. I am very lucky my cancer was caught early, diagnosed quickly and treated quickly. Not everyone is fortunate, and I'm so sorry that her family is bearing the consequences of what happens when things go wrong.
Sonia Kumar.
Deputy Speaker, despite the damning analysis of the state in which the Conservatives have left the NHS, Lord Darzi says that NHS vital signs remain strong. Does the Secretary of State agree with me that the case for the health service that the taxpayers funding it's funded free at the point of use and based on need and not the ability to pay?
Delighted to see my friend from Dudley wholeheartedly, 100% unequivocally.
Emma Foodie.
Thank you, Madam Deputy Speaker. A recent conversation with a nurse in my constituency in Brunswick Village, she shared the damning experience and increasing number of black alerts in her hospital. Does the Secretary of State agree with me that whilst this experience is of no surprise to many who've been using the NHS recently, that the Tories have pushed our NHS to the brink and it is up to Labour to fix it and make it fit for the future?
Absolutely.
Dr Darren Paffey.
Deputy Speaker, the amazing NHS staff in my constituency of Southampton-Itchen work tirelessly, day in, day out, in our local hospitals and surgeries. Will my right honourable friend join me in thanking them? And will he be clear that this is not on them, that actually Lord Darzi's shocking findings is absolutely on the appalling legacy of the party opposite, who still haven't apologised?
NHS staff didn't break the NHS, the Conservatives did, and this Labour government will mobilise them to help fix it.
And the final question, Anna Dixon.
Madam Deputy Speaker, and it was great to see the Prime Minister speaking at the King's Fund, where I worked as Director of Policy for a number of years this morning. In my constituency of Shipley, I met a man who had been told he needed urgent surgery on his leg. 18 months later, he was still waiting and had had to give up work. So, too many people, clearly from today's report, have been waiting, stuck on NHS waiting lists and locked out of work. Does the Secretary of State share my view that a healthy nation is critical to a healthy economy and work with his colleagues in DWP to deliver? Thank you.
My honourable friend from Shipley is absolutely right. The health of the nation and the health of the economy are inexplicably linked. The Department for Health and Social Care under this government is a department for growth as well as a department for health and care. The Chancellor understands those linkages too. And can I say particularly to my honourable friend and all of her friends at the King's Fund, who we were delighted to see host the Prime Minister this morning, that unlike our predecessors, this government can't get enough of experts.
That concludes the statement, and can I just thank members and remind members that we had over 45 backbencher contributions, so thank you for your patience.